Thank you, Dr. Choueiri, for joining us today. I know there's a lot of craziness going on in practice right now, and I know you've been really, really busy doing a lot of telemedicine and adapting to a lot of new practices. Things are changing, obviously, still day by day and sometimes hour by hour. So appreciate your time today. I know that you're on the steering committee for this COVID-19 and Cancer Consortium, and we've reported previously on this, but now that we're a few weeks into it, I'd love to kind of hear some of your updates and what's the latest with this consortium.
Yeah, no, I mean, thank you, Gina, for having me. So I'm on the steering committee of COVID-19 and Cancer Consortium, CCC-19, with many colleagues around the country. And now we're branching even in Europe, and we have Dr. Solange Peters, who is actually from Switzerland and is the ASMO president currently, and she is on the steering committee, making this a global collaboration where we're actually what we're trying to do is to get firsthand information, real world data on these patients that have COVID-19 and have cancer at the same time, not just patients getting active therapy, but also patients that have a prior history of cancer. So, while there are clinical trial, therapeutic clinical trial, prospective clinical trial that are ongoing with COVID-19, things are, changing very fast. And we believe that in order to fully understand this pandemic, we need to capture data on both symptomatic and asymptomatic patients that is heavily affected by this disease, and we need to be nimble and fast, and therefore the CCC-19 Cancer Consortium, which involve many NCI-designated comprehensive cancer center, and it's growing by the day. We have almost daily emails and phone calls with all the steering committee and many centers. And as we said, we're branching to Europe, a partnership with ESMO, and hopefully we start working on some manuscript and publication that should come soon. It put us all again together, because we need to understand what COVID-19 impact on our cancer patients, and it's affecting our practice. Here at Dana-Farber Cancer Institute, we moved a lot of our patients to virtual visit, whether face-to-face using the Zoom platform, or a face-to-face platform through what we're doing now with Zoom-like meeting, or phone visits. We still have also face-to-face patient encounters, but this is changing. We're at the front line of this pandemic, and we need to understand from an oncological perspective what's happening with our patients, and hopefully this is an attempt to understand more and dig more. The fact that it is national with many centers and now European will make us hopefully understand this pandemic and learn from best practices.
Thank you. Opening up this to more of a global scale must be really exciting. And do we have any kind of numbers so far on how many people have actually taken the survey?
So we are actually entering data as we speak. We have hundreds of cases, but many variables per each case. So we are, as we speak, our folks, and we have, while I'm representative at my cancer center, but we have people working on entering the data actively. Anything, past history of medication, comorbidities, and others are all entered, your cancer type and stage. We also have on the steering committee now scientist and patient advocate. Dr. Corey Painter joined us. She's a scientist from Count Me In and the Broad Institute, and herself is a cancer survivor. As I said, Dr. Solange Peters from Switzerland, ESMO president, Dr. Gary Lyman and Nicole Kuderer from University of Washington, with leadership from Jeremy Warner and Brian Reaney at Vanderbilt. Cannot count everyone on. I have to go to the website, but the website here, I got it pulled front of me if people are interested. It's CCC, 3Cs, 19.org, and it gives you tips about who we are, frequently asked question, the collaborator, the publication, and actually it is a kind of resource that is updated every day about COVID-19, and who also is doing similar initiatives. So there are initiatives that are in non-cancer patients, and here I can find them easily. There are initiatives also led by the American Society of Hematology, and honestly, the last paper we have are there. I'm looking at some initiative done from the UK, from the Thoracic Group, from the Rheumatology Alliance, from the Cirrhosis Alliance, just to understand, better. We're interested, obviously, in cancer.
This is great. I mean, the website that you have put together here, it really is a wealth of information. And, you just take a look at this map here that's on the website that's showing all the institutions, and it really speaks to how this program has really expanded in such a quick amount of time.
Absolutely. I can't, keep up sometimes with emails, but it's a group effort. So I have a call coming in an hour with them. It's a group effort with really amazing collaborators, putting the patient at the center of everything. And hopefully this is, behind us at some point, and we go back to our routine lives, although our routine lives going to be interesting post-COVID-19.
And so can you walk us through some of the information that healthcare professionals need to enter in for this survey, and really what types of trends you're hoping to determine once you have a lot more data?
Yeah, no, I think, once you go on the website, it asks you to access the survey. So you click on the survey and asks you if you intend to make a report on a patient that has a presumptive or lab proven COVID-19. If you say no, and that the survey is intended to report. So you exit the survey, and if you say yes, it asks you if the patient is registered to other, registry. And if you say this registry, then it let you ask the question if you're reporting on behalf of his institution participating in the consortium. And if you say yes, you enter the institution, which already is, captured. Let's say here, you enter one of the institutions, then you submit. And by that time, it takes you to a unique patient, number, the age, the gender, and in case you're one-to-one, of course, we have to have IRB approval, which we obtained in a very record time. I hear, less than days in some institution, just because, our leadership and clinical trial and IRB leadership are also in tune with how important this is to disseminate, the information.
This is great. How have you been doing in your practice otherwise? I know when we spoke a few weeks ago, things were obviously changing very, very rapidly. What are some of the kind of big changes that you've been noticing since we last spoke?
It's amazing how much our institution shifted the vast majority of its task force to work virtually. We're taking care of patients, whether phone, virtually, or sometimes in person. I think, our doors are open to help patients at Dana-Farber Cancer Institute. We have to work in real time. What changed is the communication. We always had a great communication, but I think now it's a hyper communication where all the time we talk, we agree, we go back and forth and re-examine because things change. It's not us, it's the virus that is dictating what we do every day and every hour. So things change from having one visitor to no visitor, to patient themselves having a mask, on and on and on. And, you know, we change every day, even who gets tested among patients and among healthcare professionals. When can you return to work? These are changing every day and in coordination. And we have, you know, daily meeting with leadership, you know, so it's going very well. It tells you in situation of hardship like this, nothing is better than communicating all the time and having an open line of communication with all the stakeholders.
There's been a lot of research efforts being discussed lately, whether it's vaccines or it's trials with some of agents that we're already familiar with and some other tumor types. Tocilizumab and leronlimab has been being explored a lot. What are your thoughts on some of these research efforts? Do you think any
Well, yesterday, it's funny, yesterday I did look at one of my favorite social media platform and Twitter, and there has been a slide tweeted about over 260 trials ongoing at this time with COVID-19. Many are interventional. So things are going, you know, very fast. But I would say that, you know, you have to be careful and take yourself out of it and say, what are we looking at? Are we looking at a study like us, which is an observational study, retrospective study, or are we looking at interventional studies with medication? And if it is with medication, have to understand that, you know, if you have a positive test, but you don't have a lot of symptoms, you may be eligible for this trial. But if you are in the ICU where, you know, you are hypoxic, people are intubated, then this is another type of a clinical trial. We do have clinical trial in Massachusetts for this. We have scientists at the Dana-Farber Cancer Institute, you know, that are, you know, tackling this problem. And I think, you know, if there is a clinical trial, mostly for patients that test positive, to look at the closest side and call your, you know, physician here. We do have, you know, trials going. I don't want to go into details. There isn't one drug that's proven to prevent this disease and work on it at this point, but hopefully we'll get some answers very soon.
Great. Thank you so much, Dr. Choueiri. Is there anything
Thank
else
you.
about the consortium you want to make sure people know about?
Yeah, well, you know, a shout out to all, you know, the centers that are part of the consortium, to the steering committee. It's really been a pleasure all coming together in a comprehensive fashion to start to ask those important questions. And hopefully we start seeing out of CCC19 publication that will help, you know, the public and cancer patients.
That's wonderful. Thank you so much for taking some time today.
Thank you. Have a great day.